So good morning and welcome to HIQA's webinar on the justification of medical exposures related to the justification of practices. So I'm going to give you an overview now of what the webinar will cover. So first of all, I'm going to give a very brief introduction to health technology assessment and introduce the ionizing radiation team that works within the Health Technology Assessment Directorate in HIQA. I will then hand over to my colleague Maeve, who will give an overview of the ionizing radiation activities that HIQA carry out and describe what is meant by the justification of medical exposures. She'll then focus in on generic justification, or also known as level 2 justification in Ireland, and then we'll finish up by describing HIQA's approach to generic justification. So as I mentioned, I work in the Health Technology Assessment Directorate in HIQA, and some of you may not be familiar with the type of work that health technology assessment incorporates. So just to start off with, what is health technology assessment? So the European Network of Health Technology Assessment defines health technology assessment, or HTA for short, as a multidisciplinary process that looks at information about the medical, social, economic, and ethical issues about a particular health technology. And it aims to look at this process and these issues in a systematic, transparent, unbiased, and robust manner, with the overall aim of informing safe, effective health policies that are patient-focused, but also at the same time seek to achieve the best value. The Health Technology Assessment Directorate and HIQA carry out a broad range of work. And this slide shows you 3 infographics, which describe, I suppose, just a sample of those pieces of work. So you'll see on the left-hand side, there is a piece of work which the HTA Director carried out, which provided advice to the National Screening Advisory Committee. And this piece of work was related to the National Newborn Blood Spot Screening Programme. In the middle, you may be familiar with the work that the HTA Directorate carried out in relation to the COVID pandemic and the ongoing support related to long COVID, which the HTA Directorate provide. And then on the right-hand side, the infographic describes a large piece of work which was carried out last year in relation to metabolic surgery, which is used as one of the treatments for type 2 diabetes. I suppose it's important to note that the basis of all the work we carry out in the HTA Directorate at the very core is evidence synthesis. And I suppose just a reminder for all of us, I suppose, that evidence synthesis is a way of combining information from multiple studies that have looked at the same factors, with the aim of gaining an overall understanding of what the individual studies found. Evidence synthesis helps us to determine how effective a particular treatment or drug is, or how people have experienced a particular health condition or treatment. You'll see there in the bottom left-hand side and on the pyramid, there is a number of types of evidence synthesis and that can be carried out, ranging from a narrative review all the way up to a systematic review. And you can see there are different levels of confidence associated with each type of review. So as I mentioned, there is an ionizing radiation team within the Health Technology Assessment Directorate. So just to introduce ourselves briefly, myself, Kirsty, Andrew, and Maeve make up the core team. And our work is overseen by Trish Harrington and Susan Spillane, who are 2 of the deputy directors, and overall overseen by Dr. Maureen Ryan, who is the director. And we're also very grateful for the input from Marie Carrigan, who is our librarian. So at this point, I'm going to pass over to my colleague Maeve, who will give an overview, starting off from the ionizing radiation activities at HIQA. Thanks, Maeve.
Thank you, Lydia. for the introduction. So as Lydia mentioned, I'm going to talk about ionizing radiation activities in HIQA, and then specifically about the role of the HTA team in relation to generic justification. So the legal framework for HIQA's involvement in ionizing radiation, as I'm sure many of you know at this stage, starts with the European Basic Safety Standards, which were transposed into Irish law in 2019. And they were transposed into two pieces of legislation, one assigning responsibility to the EPA for regulation and responsibility for workers and the public. And also there was SI 256, which assigned HIQA as the competent authority for patient safety. And within HIQA, we have the Regulation Healthcare Directorate involved in ionizing radiation, and also now going forward, the HTA or Health Technology Assessment Team also. So I'm sure many of you on the call are already quite familiar with the work of the Healthcare Regulation Directorate, and this would, their role in ionizing radiation involves monitoring and inspection of services. Also competent authority functions. So these are roles such as receiving notifications when there's an accidental or unintended exposure. They also establish and are doing a lot of work in relation to DRLs. And they have produced guidance in relation to things like dose constraints and criteria for acceptability in relation to equipment also. And going forward, HTA, the Health Technology Assessment Team, are also going to have a role in ionizing radiation. And as Lydia outlined, HTA already do, I suppose, a considerable amount of work in areas such as screening. And hence, I suppose, it makes a lot of sense for HTA to be involved in the aspects of SI 256 that relate to screening. And this would include those two sub-regulations there, 8.6 and 8.3. So justification of medical radiological procedures within a screening program. And also HTA will be producing guidelines for practices which take place outside screening programs on asymptomatic individuals. And HIQA's HTA team will also be responsible for aspects of Regulation 7, and that is justification of practices, also known as generic justification, which is a new function which has recently commenced and is the focus of the webinar today. So in terms of background, we might just start by talking a little bit about justification of medical exposures. And the principle of justification, of course, is that an exposure should do more good than harm by weighing up the benefits and risks. And it considers the benefits to the individual and to society, and taking into account alternative practices which give less or no exposure to ionizing radiation. The ICRP talk about 3 levels of justification. So we're just going to go through those. So starting with level 1 justification, and this considers, well, is it a good idea to use ionizing radiation in medicine at all? And I suppose it's very much taken for granted that this is a good idea. So that's level 1 justification. Level 3, this is about justification of those individual medical exposures in advance of them taking place by a practitioner, and this is outlined in Regulation 8. And for many of you on this call, this may be part of day-to-day clinical practice. There's also then level 2, that's the one that sits in between 1 and 3. And this is about justification of practices or generic justification. And it looks at the benefit of a practice, the risk versus benefit at population level for a type of practice for a specified objective. So for example, is it a good idea to give chest x-rays to patients presenting with certain symptoms, for example? And just to note, let's say a practice is generically justified, there's still a requirement under Regulation 8 for that level 3 or individual level justification of each individual medical exposure also. So I'm just going to talk a little bit in terms of generic justification in Ireland and some of the requirements that are set out within the regulations themselves. So firstly, the requirements that are actually placed on HIQA within the regulations. Under Regulation 7, HIQA must justify types of practices in advance of them being generally adopted. HIQA must also consider reviewing existing practices if new and important information becomes available about their efficacy or maybe about alternative technologies. And when considering generic justification of a practice, HIQA will also take into account associated occupational and public exposures also. Then the regulations also set out responsibilities for persons, and these would be persons involved in carrying out medical exposures, for example. And the regulations state that a person cannot carry out a new type of practice which has not been justified in advance by HIQA. And if HIQA has reviewed a practice and found that practice to be not justified, then a person cannot carry out this class or type of practice. Under Regulation 8.9, there is responsibility placed also in relation on the undertaking. And this lays out where a practice is not justified in general, that there is provision for justification by a practitioner on a case-by-case basis, but noting the regulations state this is for special circumstances. And I'm just going to talk you through next, I suppose, HIQA's approach to generic justification. And we have published a methods document on our website, which outlines our approach in detail. And just to note that this function is now live, we are open for applications, and there is one application currently in progress, and this is in relation to a new practice involving a new radionuclide, that is lutetium-177, and this is in the context of neuroendocrine tumors. So what other kind of new practices will HIQA review? Well, the regulations refer to a new practice or a class or type of practice, and varying approaches have been taken to this across the EU. A class or type of practice broadly refers to the technology and the indication that that technology will be used for. So while HIQA commenced this function recently due to resourcing, we were commenced just in January 2023. The regulations themselves commenced in January 2019, and hence a new practice is one that commenced since that date in 2019. So we are open for applications of new practices, but that would include those that have commenced since January 19. And we absolutely understand that undertakings and services had to continue to provide and progress services during that time. And it was noting it was obviously, of course, a very difficult time in the context of the COVID-19 pandemic, and for some services, a cyber attack also. So just in a little bit more detail from HIQA's, from our methods document, what in Ireland will typically kind of constitute a new class or type of practice. Well, that would be a new technology, for example, a new radiopharmaceutical, the use of an existing technology for a new indication. So that would be a new clinical condition, say under a particular type of investigation, a new combinations of existing technologies for a specific indication. So for example, mammography and tomosynthesis for breast cancer screening. New intended population, such as a change maybe from asymptomatic or symptomatic to an asymptomatic population, or an adult to a pediatric population. And in the context of radiation oncology, a new indication, site, or population for hypo or hyperfractionation. And one kind of question that we've had a lot is in around kind of dose optimization. And dose optimization, of course, there's regulatory requirements in the context of dose optimization outlined in Regulation 9. But in general, dose optimization is a separate concept to generic justification, and changes in relation to kind of dose optimization wouldn't constitute a new type or class of practice. So for example, in diagnostic imaging, maybe changes to planning parameters will be considered optimization. Radiation oncology, it might be something like changes to beam orientation using the same radiotherapy technique, again, will be considered kind of dose optimization. So I'm going to take you through the steps involved in the application process to HIQA for a new practice. And this is a relatively kind of busy schematic from our methods document outlining the process. So I might just talk you through a few of the kind of key points. So starting off with HIQA receives an application for a generic justification, and an application might be received from an undertaking, but not necessarily. It could be, for example, a national body that submits an application to HIQA, and then we will review the application and decide whether or not the practice requires generic justification. Then evidence synthesis is carried out by HIQA's HTA team in relation to the practice. A recommendation is formed by an expert advisory group, and I'll talk a little bit more about that in a moment. And finally, a decision is made by HIQA's HTA director, taking into account the evidence and that recommendation from the EAG. And to note that there are varying levels of review. So we have kind of three sort of options for review for the level of evidence synthesis that will take place, and that would be a rapid review, a review of prior evidence synthesis, or a full evidence review. And the decision regarding which type of review will take place is kind of outlined in this matrix, and it takes into account how new is the practice in the kind of in the international kind of context, and also like how big a change is it? Is it a very big change to the dose, and in terms of risk, is this a big change from the current practice? Now, we are quite cognizant, I suppose, in Ireland, it's probably most likely the practices that we are bringing in as new practices might already be established, perhaps within the EU countries, and there might be already a body of evidence perhaps available. So all of that is taken into consideration when we're considering what type or what level of kind of review will take place. I mentioned that we have an expert advisory group. The members of the group are published on our website, as well as the terms of reference for this group. To note, membership includes patient advocacy group representatives, other regulatory bodies are represented. We have representatives from professional bodies and also from national clinical programs. This EAG has met already once this year, and we have 2 more meetings planned for 2023. So the aim is kind of 3 meetings per year, and the list of the current members is there on screen. It includes, we have an international expert from the Norwegian HTA Society there. We also have a methodology expert, and also if we're looking at a particular practice, it will probably be most likely we will be able to bring in an expert in relation to that topic as well. So in addition to the kind of the membership that's there. In terms of other work, we mentioned screening and guidelines for screening at the beginning of the presentation. So this is another piece of work that is ongoing by the HIQA HTA team at the moment. So we will be producing guidelines for asymptomatic individuals outside of screening programs. This work is underway. Scoping review has been completed. We're planning on carrying out focus groups for this, and there will be continued stakeholder engagement in relation to these guidelines also. So I'm just going to summarize, I suppose, a few key points from the presentation. Firstly, HIQA is the competent authority in relation to patient safety and medical exposures, and must generically justify new types of practices post-2019 before they are generally adopted. HIQA can review existing practices if new or important information emerges, and the generic justification includes medical exposures that take place as part of a screening program. There's provision in the regulations for generic justification in special circumstances on a case-by-case basis, where a practice isn't justified in general, and the provisions of this regulation are outlined in Regulation 8.9. And in most cases, dose optimization is a separate concept under the regulations and doesn't represent a new type or class of practice. Now, a lot of the information that's been provided today is available on the website. So if you go to www.hiqa.ie, there's an ionizing radiation page, and within that there's you're either directed to the regulation information or generic justification. It's justification of practices. So on that website, you can see how to apply. The application forms are available there. There's information about the expert advisory group. There's also a list of applications that are in progress that we're currently progressing, and there is reports, and I suppose decisions and reports, etc., will all be published on the website also. Our contact information is radiationjustification@hiqa.ie, and the phone number is there. And also, as I mentioned, lots of information on the website. Thank you.